women that took estrogen replacement, bioidentical estrogen replacement for 6 years or longer into menopause had a 75% reduction of getting Alzheimer's or dementia.
So I'm really, really excited and been looking forward to this episode today with Karen Martel, who is a certified hormone specialist. I get so many questions from listeners, members of my Facebook group, my Instagram community, all about hormones. And I haven't had someone yet specifically come on the show to really dive into hormone replacement therapy, the myths, the misinformation around it. But we're going to do that today. So Karen, first of all, a very warm welcome to the show.
Well, thank you for that warm welcome. I'm excited to be here.
Yeah, I'm so excited to have you. So I think let's first start off. When people think about hormone replacement therapy, obviously it isn't a replacement for doing all of the lifestyle things that we talk about, but for them to first really understand, because there are 3 different types and people get confused and they think, should I be taking synthetic hormones? Should I be taking bioidentical and like seeing compounding pharmacy? Should I have body identical? Can you just explain, first of all, in a nutshell, what hormone replacement therapy is and what the different options are?
Yeah. So hormone replacement therapy traditionally, of course, came from, not from bioidentical, it came from pregnant horses' urine. Go figure. And this is what's very interesting, and nobody knows this. In the 1950s, estrogen, which was called Premarin, which is the horse's estrogen, was the number 1 prescribed medication in North America.
Wow.
And it remained there for like 50 to 100 years or something, like ridiculously. So it was the number 1 prescribed medication for a very, very long time. And then they decided they thought it was an amazing thing. They used it with fake progesterone that was made in a lab. Synthetic progestin is what it's called. They would use the 2 together for women in menopause, and they thought it was just amazing. So they thought, we want to prove how great this is. Let's do the biggest study. It was one of the largest studies ever done on HRT. And this is traditional hormone replacement therapy, which is still around today. This was back now in the late 1900s, like 1998 to 2002 is when it went. They were supposed to do it for 10 years. They had a few arms of the study. One arm of the study was the horse's estrogen with the progestin. There was another arm of the study where women had their uteruses taken out. So they were just on the Premarin, not on the progestin, because they used progestin in order to counterbalance the growth in the uterus, because estrogen is a growth hormone. It's what creates that lining, and then we bleed it off. So without progestin or progesterone in there, then you don't have something to counterbalance that growth, because progesterone will stop that growth and then you get your period. Without it, you can get uterine cancer because that growth goes out of control. So they had the arm of the study, and then they had one that, of course, had nothing. In the first 4 years, they halted the one arm of the study that was the progestins with the Premarin, because they saw a small increase in uterine cancer and breast cancer and strokes. So they freaked out. They yanked the study. They sent out word to the world and to every physician out there, take every woman off of HRT. It's killing them.
A bit dramatic, right?
A bit dramatic.
It did cause major panic. That's the thing. It did, didn't it?
And
I remember
still to this day, 2022, you ask a woman if she wants to be on HRT, or even if you say, do you want to take any hormone replacement, bioidentical, whatever, synthetic, she'll go, oh, no, that causes breast cancer. Every woman out there right now thinks that hormone replacement is dangerous. So there has now been several reevaluations of this study done. What they found was the arm of the study that had the fake progestin in it was the one that had that increase of uterine cancer and strokes. The other arm of the study, that was the Premarin only arm of the study, had a 30% reduction of breast cancer. That's crazy.
Yeah.
Right?
The
Everyone
difference.
thinks it's going to, every doctor thinks estrogen. I've had doctors on my podcast. I had a doctor on there who's a hormone doctor who said, never take estrogen, it'll give you breast cancer.
Wow.
So this is what doctors think out there. I get it all the time in my practice where women come to me and say, my doctor says, no, it'll give you breast cancer. So this is horses' estrogen, which is nothing like our own.
I was going to say.
Right? Taking it orally, when you take it orally, it has to go through what's called the first hepatic path of the liver, and it can create inflammation of the heart. And you can actually, it does increase your risk of heart attack and stroke when you take estrogen orally. But even so, this study showed that it helped reduce risk of breast cancer in women. But yet nobody heard that. Nobody's heard about that there was this reevaluation done, and you can all look it up. Several like very, well-respected doctors that have reevaluated this. So many years later, we created bioidentical hormone replacement therapy. Now, this is different. It's not coming from a horse now. This is coming from yams and soy, and it is made in a lab, and it is body identical. So it means that it is identical to the very makeup of our own progesterone and estrogen. So your body can't tell the difference, what's coming in from outside or what you're producing on the inside.
It's the same. Now, this is where we have a slight distinction here in England. So we have three. We have hormone replacement therapy, which is the synthetic hormone. And then we have bioidentical hormone replacement therapy, which is unregulated. So we have these guidelines, NICE guidelines, and this is unregulated. You have to go to a compounding pharmacy. And then there is a third type which doctors can prescribe on the National Health Service here, which is body identical hormones, which means body identical here means they are regulated. So there seems to be two types of bioidentical, right? There's ones that are regulated and ones that are unregulated. And the unregulated ones, you have to go and see a private prescriber, doctor, and they're done by a compounding pharmacy, so they can get a dose exactly to you, and it is much more expensive to have than the body identical. Is that the same in Canada and North America?
Same in Canada. Yep.
Okay.
We don't call it that. It's either you go for compounded or you go for pharmaceutical.
Oh, okay.
Right, from a pharmaceutical company, and those are in exact doses. You can't mess with them. So the highest you can get is, I think, 1 milligram with the patch, the estrogen patch. And so it is made by a pharmaceutical company. It's an exact level rather than the compounded, which you can tailor to your needs, which of course is better for most cases, especially as you age and get older and you need to really up the hormones. Then the compound is better than the other one, but yes, more expensive. Our medical system will cover, like if you've got extended medical, like all of my hormones are covered because I have great extended medical, so it's free. But if I was doing compounded, it would be hundreds of dollars.
Yes, yeah, but then you can actually dose, but then they're not been regulated because those doses haven't necessarily been specifically investigated or regulated.
Yes, and there's a lot of, like in the UK, New Zealand, Australia, there's like if you start to Google it, you'll actually get pages where they just diss compounding pharmacies. It's like, this is unregulated, this is so bad, and it's like, no, it isn't. Like, we are meant to have more than just 1 milligram of estrogen a day. In our fertile years, we're all the way up to like 30, 40 milligrams in a day in certain times of the month. So it's when they say like, oh, it's unregulated, or you're not going to get the exact amount. It's like, hello, our hormones are never the exact amount.
Yeah, exactly.
So it's silly. They shouldn't diss them. Compounding pharmacies are absolutely amazing. I believe that. Yeah.
Perfect. Yeah. Well, thank you. Yeah, thank you for clearing that up, because I think that's the first thing everyone listening needs to understand, whether you're male or female, because actually it might be that you're listening and on behalf of your partner. So we now know what they are. Now what we're looking at is obviously like the things that I work on with my clients is, baseline inflammation when we hit perimenopause is increasing. Insulin sensitivity is reduced. Yeah. Cortisol is going up, partly driven by the fact that often actually women just have really high stress in their life at that point. But also if they are highly stressed, they're not producing as much progesterone. And now if they're having anovulatory cycles, the adrenals are not kind of picking this up. So often, and I'm guessing you find this, Karen, with your clients, there's quite a lot of stuff that you need to do to support what they really want, which is better muscle mass, better weight loss, reduced hot flashes, better sleep, and all the things. However, they can also have hormone replacement therapy. And from some of the literature I've read, it would suggest that actually, as you approach menopause, is a good time to be doing this, because the benefits seem to be superior than you going through and just struggling and kind of white knuckling your way through this process. And then afterwards going, oh my God, I'm exhausted. Can I have some now? At which point a lot of doctors here turn around and go, nah, you're well over it. It's too late, which is a horrible position for a woman to be in.
Yeah. So let's back that up, because you become more insulin resistant as you age because you start to lose your estrogen. Mm-hmm. Estrogen really helps us to become insulin sensitive. And then as you go farther into your 40s, typically, and it can happen earlier, but typically it's when you're going through your 40s that you start to lose estrogen. Then estrogen helps us to make serotonin, which then helps us to make melatonin. So that whole process, when the estrogen goes down, suddenly we're not getting as much melatonin anymore, which will affect your sleep. And here's something very interesting is melatonin can block estrogen receptors. I think personally, this is because you think back to hunter-gatherer days, when the days were longer, it meant it was winter. So melatonin would be on more, right? In the winter times when it was dark. We didn't want to get pregnant in the winter as a hunter-gatherer because likely the baby would die. We wouldn't have enough food around. So this was like this natural built-in mechanism where it was like melatonin, when it was on more, meant that estrogen levels would come down. And when estrogen levels come down, it also means that that progesterone will go down, because estrogen makes progesterone receptors. Mm-hmm. So fast forward 2022 now, what will happen to the body as we're aging and we're losing this estrogen, the body will start pouring on cortisol to block melatonin so that the estrogen receptors can be there, because we're starting to lose estrogen. Your body's smart. It's going, quick, get us we need more estrogen. This isn't good. Estrogen has over 800 functions in our body. There's receptors for it on every organ in our system. We need our estrogen. The body will also start gaining weight because you can make a type of estrogen out of fat cells called estrone. So this is why women start to gain weight. So yes, we want to start these hormones when we start to lose them, because all of these mechanisms start coming in. Women start gaining weight, they start hot flashing, their libido goes out the door, they're not sleeping, the vagina starts to shut down because estrogen is so needed for vagina atrophy, like for moisture, and if without it, it'll start to atrophy. So that your body goes, okay, start putting fat on this woman. Quick, we need some estrogen, right? Don't let her sleep. We need some estrogen receptors. So now you're a hot mess. You're 20 pounds overweight, and your doctor's going, no, you still have your period. You can't have estrogen yet. Nope. It's not good. So I believe we should be starting at an earlier age before we get to menopause. Now, menopause is considered 1 year without a period. So if you're starting to get the symptoms, then get a practitioner that understands this so that you can start a little bit earlier. You do want to prepare your body for it. Like you said, you got to eat right. You got to take down that inflammation. You got to exercise for those hormones to be circulated throughout the body. And it's not a quick fix. Like some women really think, it can be a quick fix. I've had women jump on hormones and like in 1 month, they lose 10 pounds. Not very often though. So in most cases, it's not a quick fix. You're not going to it's not going to be this magic weight loss pill. And if you're under the age of 40, there's a lot that you can do to balance the hormones out without taking any hormones, because your ovaries are still going for the most part, right? So you can take things that are going to help you to produce the progesterone, help you to produce estrogen, and balance those two things out. But as you start to age and you're in your 40s, and this happens at different times for different women, I start to go through it at 42, which is really young. When you're in that phase, there's no amount of supplementation or diet that will bring back ovarian function. It is strictly a matter of your ovaries are headed out, the adrenal system starts to take over, and you can't supplement your way out of that. Supplements are going to help your body through this process, so is being healthy in all forms. But as far as the hormones go, there's no replacing of the hormones unless you do it through either HRT or bioidentical HRT.
So you need to actually, but as you say, it's something that you should see a little bit like a supplement. Is it supplementing the other things that you're doing? Is not a replacement. Now, what about, so like in the early stages of perimenopause, women often will experience heavy bleeding. They'll get some like skin issues that they weren't getting before. They're maybe not yet at the hot flashes, and they may be having anovulatory cycles. So their cycle's sort of shortening and then it's lengthening. And then over time, it happens that it's like, oh, I've skipped a period. But sometimes what I've seen is, you'll see a woman and actually you address some of the underlying hormone issues and actually her cycle starts to regulate again. And then she's having regular ovulation and then she starts to skip periods. Now, would you say that it's at this point that you're beginning now to skip periods? You're like, 2-3 months have gone by. I'm getting hot flashes. I haven't had a period. It's a frustrating time, isn't it? Because then the clock resets. So you go, oh, I must be near menopause, right? In 1 year, I'll have gone through. And then it's like, you might even get to 8-9 months and you're like, a period's shown up now. Let's just restart the whole clock again.
It's so dumb.
Like, no, I'm not postmenopausal.
The whole 12 months without a period is just a number somebody made up.
Yes,
it's ridiculous.
It's crazy because also I've seen women who go on extreme diets like the ketogenic diet and ostensibly go into menopause and then they stop it. Because when you sacrifice carbs, you're really elevating cortisol often, and then their cycle comes back, body calms down. It's like, oh, I'm a bit more fertile again. Where is the point for women listening that you've found has the most efficacy, and what does the research say of when you should go in and actually start hormone replacement of any description?
So most women don't know that at 35, 38 is when we start to go into perimenopause. And the first thing that typically happens is we lose our progesterone. So by the time you're in your 40s, we'll have lost about 75% of our progesterone because we're not ovulating anymore. You can't make progesterone unless you ovulate. So like Angela just said, your cycles will suddenly get shorter, irregular, or you get a really heavy period because you don't have any of that progesterone in the second half of your cycle. Remember, it's the one that stops that growth. So if you don't have progesterone, you get this overgrowth of that lining, which then leads to really heavy periods. Estrogen, on the other hand, goes for a wild ride through your 40s. There'll be some months where, it's crazy. There'll be months where you'll have lots and too much estrogen. And this is where the whole true estrogen dominance that I see typically, like every woman out there thinks she's estrogen dominant. Do you find that, Angela?
I do find it, a lot. And actually, sometimes what I see is actually they're describing it, and actually their estrogen and progesterone looks okay, but they've got really, really low DHEA. They've got high cortisol. They're in a catabolic state. They've got low testosterone, and that's why they're struggling with motivation and getting out of bed and muscle mass and insulin sensitivity. So it isn't always actually estrogen dominance.
Yeah, that's such a good point. I've listened to women. I've heard one woman on a podcast, like she went for 8 years being diagnosed with like fibromyalgia and chronic fatigue syndrome. And she tried estrogen, progesterone. Finally, somebody put her on testosterone and it was like the light bulb went on. So those are the more androgenic adrenal hormones, and they have a massive impact. They are very from person to person, it really varies. I've seen women that are in their 60s and 70s with really great testosterone levels. So some women will lose their testosterone and their DHEA, and others, they don't. So it's like you once again got to test to find out. Don't guess. Guess. Every woman thinks she's estrogen dominant. I have an article, a blog post on my website that's about estrogen dominance. It's the most visited page in my entire website. And I've got hundreds. And I'm like, every woman thinks, and they're all taking DIM and all these things to help clear out their estrogen. But what typically, I've done probably over 1,000 hormone tests. And for sure, I've seen women that are truly have way too much estrogen in their body. But in most cases, 80% of the time, it's that they have healthy levels of estrogen. They're xenoestrogen dominant, which is different. And they're losing their progesterone. So they're dominant in comparison to that progesterone level. So we just need to bump up progesterone. So when it comes to replacement, I do have a lot of women in perimenopause start taking progesterone cream in the second half of their cycle, or oral progesterone, because it really, really helps to counteract that growth of estrogen, really helps with the PMS. Progesterone is very calming, acts on the GABA receptors in the brain, so will help you to sleep. It's very
It can be quite difficult to persuade some doctors to prescribe just progesterone here. It can take some work. They're like, oh, no, you still need to have your estrogen. So that is always can be a bit of a battle. I don't know what it's like in Canada, but that can be for some women. It can be quite difficult. They're reluctant to just give progesterone. But I agree, it is so calming, and that's really what they need, right? That's the thing.
Oh, I've had women text me and be like, could I honestly be feeling this the same, like the first day I've used it? I'm like, yeah, you can. And they're like, yeah, I feel so much calmer with my progesterone. It also helps to raise your metabolism. So it can help with weight loss, can help with insulin sensitivity, can help with your gut, can help with your bone formation. I mean, a lot of doctors think, oh, if there's no uterus, no need for progesterone. No, progesterone actually helps us to make the myelin sheaths in our brain. It's super important. So I say start progesterone. Usually that comes first. Check your DHEA, check your testosterone levels and see what those are, because those can be, like I said, different from person to person. And then just start watching that estrogen. Start watching your follicular stimulating hormone, because when that starts to go up, that's your brain trying really hard to get your ovaries to work.
Yeah, and that's so like shouting. You can't hear
shouting
me, so
and shouting. It gets louder and louder.
Shout even louder, yeah.
Yeah, and so it's interesting because some people will say, well, aren't we supposed to go through menopause? Like, this is natural, it's life. Well, we're living longer than we ever have. And wouldn't our FSH, the follicular stimulating hormone, stop going up if we were supposed to go into menopause? So this is like trying for the rest of your life. It's going to try to stimulate your ovaries, even though they're dead. They're gone. It's going to keep going. So all the research, when you start to really dig into bioidentical hormones and even HRT, even Premarin, there is benefits to it. And it shows that women that replace their hormones for 10 years post-menopause, so let's say you've got your year under your belt, 10 years, the research shows that women are better off to replace their hormones than not to replace their hormones. There was a new study that just came out of Arizona last year. This was awesome. It showed that women that took estrogen replacement, bioidentical estrogen replacement, for 6 years or longer into menopause had a 75% reduction of getting Alzheimer's or dementia. That's
really interesting.
Mind-blowing.
Because that's super interesting, because the brain does go through this reorganization, doesn't it, around menopause. And the research shows that menopause itself can be a triggering event, which, to be honest, for someone like myself who has APOE4,
Me too.
that is always you too, yeah. And this lack of sleep that people experience, they think, oh, it's okay, I can get by. Actually, no, that is really aggravating this risk. It's not causal, but we know that people with Alzheimer's definitely have problems sleeping as well. That's the thing.
Yep.
But when you say that 10 years, because I guess a lot of women listening have a question in their mind over, well, I'm taking hormone replacement therapy. How do I know when is the right time to come off? Because they know that they shouldn't be on this forever. And actually, my understanding is the research shows if you're getting into like late 60s, 70, this is when there could be a risk of taking it. Can you just explain for that? And also, how do you come off it? How do you transition off it?
So just so everybody knows, you can stay on your hormone replacement for the rest of your life. I plan to, especially because
with no risks.
No, with some risks.
With some risks, okay.
But here's the thing. Most of the long-term studies have all been done on Premarin.
Okay.
And so it shows that after that 10-year window, there's a very, very small increase in heart attack and stroke as past that. But that's with Premarin. Remember I said Premarin taken orally is a whole different story because you're putting it through the first hepatic pass, which can cause blood clots and stroke. So when you start to try and find information about bioidentical hormone replacement therapy long-term, there isn't a lot of information out there about long-term what it can or can't do. So I think, and I know so many, I have women that start hormones past that 10-year window. My mom being one of them. My mom her dad died of Alzheimer's. She was starting to worry about her own brain. I'm also worried about it because I have the ApoE4 gene. And she started to really get scared. She couldn't remember people's names. She was foggy in the brain. She was gaining weight in her midline. My mom's 66 and she's been in menopause since she was 42 because she had a hysterectomy. So this is long past that 10-year window. So I started her on a really low dose of estrogen. And she would have been still on progesterone. She'd always loved her progesterone. She never stopped that. So I got her on estrogen. 3 months later, she had lost half of her stomach weight and she could not believe how much better her memory was. She says, so much better. I can think clearer. My brain's not so foggy. I'm in a better mood. I feel good. This is amazing. And this was on a very small dose. This is like a 1 milligram a day dose.
Interesting.
So when you look at it like that, it's like, well, why would we, without estrogen, we'll develop osteoporosis. We'll develop heart disease. Heart disease and Alzheimer's are the top 2 killers of women right now. And heart disease in women is not the same as heart disease in men. Men, the heart disease man, they've got that great big hard belly out the front of them. It's from metabolic disease. Women, you don't see that. It's a different look to them. It's not driven by metabolic disease. It's driven by the loss of that woman's hormones. So we've got bone health. We've got serious brain health. I mean, everyone says there's no cure for Alzheimer's. Hello, estrogen, 75%. That's absolutely unbelievable. So why would I want to take away my estrogen and let my brain atrophy? Yeah. Sex drive. Everyone thinks it's testosterone. And yes, testosterone is the one that makes you want to go out there and get the sex, but estrogen is the one that wants to make you actually do the act of sex. And there's 3 estrogens. One of them is called estriol, and it's mostly in the vagina tissue. And that's, like I said earlier, if without that, women's vaginas atrophy and shut down. Like literally they cannot have sex. I've had women just cry to me.
I've heard women say that, and it's like sandpaper and no lubricant is going to help, and it's awful. And doctors are like, well, I've had so many people say to me that the male doctor has turned around and said, well, you don't need to be having sex anymore. And it's like, no, this is not fair. That is an awful thing to say to a woman. Yeah. And I've had more than one person say that to me. That is so rude, because
it's terrible.
How is it different from a man, right? Men can go on to have children at any age. That is not the thing to say.
Women are told to kind of suck it up and get through this. It's terrible.
But why do you think, what some of the interesting things, isn't it, is although we are living longer, we do see that in some populations where they're healthier and they have a higher number of centenarians, they have less stress, they seem to transition through menopause a bit easier. It's a bit like the women that they just float through pregnancy that I never did. The women that you look at and you're like,
I don't like those women.
She floats along and it's all so lovely and elegant. And that was me with my head down the toilet. How does that work?
Fat and barfing through the whole 9 months.
What happened there? But they do seem, in menopause, there are populations, right, who have an easier time. And I think that's why the lifestyle stuff alongside it is so important. I think people think, there seems to be this perception that, I don't know about you, I'm trying to correct, where people think, no, I'm either someone who takes hormones or I'm someone who's all natural and I'm all lifestyle. And it's no, actually the magic happens when you put these 2 things together.
100%. I totally agree. And it's sad that we as, North Americans and Europeans, we're not going through menopause like we used to. We're not going through menopause like some places, some cultures out there. And there's so many factors in that. We're super toxic. We're super stressed. I mean, just even not even if you're emotionally stressed, just the stress of our environment is like nothing we've ever had in history. So there's a lot coming down on us, and we are lasting longer than ever before. So there's all these little factors that come in. And I always say, like, great, if you want to try to go through menopause without hormone replacement and you're doing great and all your markers are good, then awesome. But what's going on behind the closed doors that maybe you don't know? Maybe you're a person that you're not having hot flashes, you're not gaining weight, but like we said, you become more insulin resistant, you become more leptin resistant, your cholesterol goes up, you can even get fatty liver disease. You had one of your members ask a question about histamine intolerance.
Yes.
Why would that come back as she aged? Estrogen can drive histamine. And so when you lose your progesterone counteracts the histamine. So when you lose progesterone, you can suddenly become histamine intolerant. So
which is hard. I mean, histamine intolerance is really difficult. Restricts so much what you can eat, what you can do.
Yeah.
However, but what's curious about that is when you've made that transition and now your estrogen, because often I've seen that happen in menopause, but the question from that member was, why is it I've had histamine intolerance, I've now gone through menopause, so estrogen is now really low, and now suddenly there's this revival of histamine intolerance. Have you seen that happen?
Oh, no, I haven't seen that happen.
Interesting.
I would say
can
that
have
it's
histamine intolerance
likely
at any age.
I was going to say she probably, because she's prone to it, she's had it in the past, either stress or even the lack of both estrogen and progesterone really help get rid of leaky gut. And so without it, our gut becomes affected. So it could be that, it could be she took antibiotics, she took, the vaccine, something that maybe would have harmed her gut bacteria so that the histamine intolerance came back.
Yeah.
Is my guess.
Yeah, interesting. I mean, one thing that's interesting, what you mentioned there, is I think we were talking the other day, had people who have taken the vaccine and come out of menopause. They've had a period of women that are in their cycling years whose periods then just stop. I know you've dived into this a little bit. It seems from what I've seen that the spike protein affects the ovaries, but doesn't seem to affect the testes. What isn't clear to me from what I've seen is, does that happen just with the vaccine, or does that not happen with COVID as well? You don't tend to hear about people who've had COVID who actually are now skipping periods or bringing periods on.
Yeah, no, and I haven't either. I've heard some people doctors and people say that COVID can affect your cycle, even, natural COVID, but yet I haven't heard from anybody that happened to them. I've only heard it from vaccinated individuals that suddenly I've lost my period and it hasn't come back, or it went away for 3 months or whatever it might be, or a menopausal woman gets her period back. And did you listen to the Joe Rogan?
I have listened to some of it. I haven't gone all the way through it.
It's like 3 hours. So he's the man that created the mRNA or was part of that creation. And so he said there's never been a study done on it, which is really sad. They've now given the Johns Hopkins Medical Center and a couple other institutions $1 million to research this, to see what's going on. So he said there was no studies done on it, but there was a study done on something like that had a spike protein in it on rats. So I don't know if it was I can't remember exactly the details, if it was the actual mRNA or if it was something else, but he said it was almost the exact same, but only done on rats. And they found that the spike protein settled in the ovaries and the kidneys, but not the testes of men. More the men were getting the heart inflammation. So, and he said, that's scary. He said that. He's that's, come on. And the society, the governments are like, it's fine, it'll come back. And same with the heart inflammation. Oh, don't worry, it won't last. But yet we don't know that. And he says that, he's like, how do we know that? There's never been any long-term studies. We don't know if this heart inflammation is going to go away. We don't know if the infertility is going to go away. Most women, I think, that I've spoken to, their periods did end up coming back. But you can find stories of women that they're still sterile from their vaccine.
Really, months on, they're not having any periods.
Months, like 9 months, I heard, but this is all hearsay, but yeah.
A long time. And in terms of from your own experience with women and kind of the weight gain that they see, because I know this is an area that you see a lot, right? You found that obviously women, when they start taking hormone replacement therapy, sometimes they will have dramatic weight loss. Have you seen that if they then stop it, so they decide they actually only want, like some women, despite what we've been saying here on this episode, they do feel that they only want to take it for a limited time. Have you seen any rebound in weight following stopping of it? And I know that's really difficult right then, but more maybe in your own practice you've seen that, or maybe from studies, because I'm not sure it has been well studied, and it's difficult because there's so many other factors at play, right? You could be eating quite differently, you might, and there's usually a life change by the time you get to that point. Women have gone into retirement, they're living a different lifestyle, they might be enjoying more food and wine, they might be more sedentary, there's so many factors.
Yes.
I'm just curious if you've seen any correlation with coming off hormone replacement and then maybe weight regain.
I haven't, but I also don't know of anybody that came off of it.
Because everyone loves it so much.
Yeah, but I would think that because of how it happens, the weight gain typically starts to happen in perimenopause, and then we'll keep going into menopause for about a year, sometimes 2. And then it seems to plateau. And then you go back to that normal kind of, put a pound on a year because you're aging and your metabolic rate might be slowing down, or you're, like you said, you're more sedentary, you're not eating as well, whatever it might be. So I think that it would probably not, you probably wouldn't gain what you would have gained in perimenopause. If you have taken the hormones, you're well into menopause, let's say you're 5 years into menopause, you've been taking the hormones, and then you wean yourself off of those hormones and you feel good, then no, I don't, you might gain a couple pounds, but I don't think it would be as drastic as it would be in perimenopause. Because in perimenopause, things are just, it's like everything's just going haywire on the inside,
so
right?
much disruption. And I also think a lot of women then actually, they've forgotten about the fact that strength training was ever important, right? They just lost sight of it and they didn't do it. And I always think when people say, but it's right, it's boring, it's like, do you know what? Some things are a little bit boring, put some music on, but if they really benefit your bone health, your metabolic health, and the way you look, right? When you put on your clothes, you feel better, then actually just a few hours a week, it doesn't have to, even if you start using things like super slow strength training, you can get this done in a maximum of about 45 minutes a week. It's really not a massive deal to fit that in out of 168 hours. It's so worth it.
It's so worth it. And if I had to choose one exercise for every peri and postmenopause woman, weightlifting, 150%.
Same here. Weightlifting and walking, right?
Yes.
But everybody goes for running and Pilates.
Yeah.
No, forget the running and Pilates, weightlifting and walking.
Yeah, I always say running will probably just make you fat in perimenopause.
Yeah. And it'll definitely give you more belly fat.
Yeah, it will. It's stressful to the system. Our cortisol, our adrenal system, it's not the same when we're older. We're way more sensitive. We're nowhere near as resilient. So you have to be very careful about how you're trying to lose weight. And like you said, like so many women right now are going on the ketogenic diet. And I just see this completely destroy hormones. It's crazy. And don't get me wrong, I was on the keto train. I still have a very, lower carb program for my ladies, but I cycle those carbs because we as women, we've got to eat the carbs, you guys. It's don't listen to all the carnivore, keto, male dominated world out there, because they'll tell you that our natural way to be is in ketosis, which I completely disagree with. It was our backup source of fuel when we were in times of starvation. So when you first start out and you're heavier, keto's like a miracle diet. It's amazing. And women will lose all this weight And then I see it time and time again where it all starts to reverse.
Go back, yeah. And also genetically, there's a risk. You just don't know. If you haven't tested it, it's fine. I find that going really low carb or ketogenic for 6 to 8 weeks, if you're metabolically inflexible, can help develop metabolic flexibility.
Yes,
but why would you want to pick one diet when you could have the gift, which is metabolic flexibility? Now you can have carbs and fats and you can transition easily and you can be like a kid again and actually enjoy food. Why would you not pick that? It's way more fun.
Oh, exactly. Same with like the carnivore. It's like, but why? Why do you want to stay there? I wouldn't want to eat meat for the rest of my life.
I think I would actually have quite bad acid. I'm someone who does struggle a little bit with reflux. The carnivore diet to me, I mean, I'm quite high protein, but I think that would be difficult. And also, if you think estrogen's going up and down so much, you've got to detoxify that excess estrogen. So if you're not having fiber and things like that that are helping with that phase 3 in the gut, that would concern me as well. You can see why they might be struggling with their hormones.
Yeah, and they're great tools. I think I put women on carnivore all the time if they're super insulin resistant or type 2 diabetic. It works like a dream for that. And just as a reset, but as soon as possible, same with the keto diet, use it as a reset, but then start putting back in carbs, do some carb tolerance testing, see how sensitive you are to certain foods, create your perfect diet. And that's so important right now in this world where we're being bombarded by, this is the next best diet, do this, do that. For sure, primal based diets tend to work better for weight loss and for hormones and inflammation and gut health. But it's not to say that any of these other diets aren't good too. It's just, I see that those work better because it's easier to be in a caloric deficit when you're eating animal protein compared to a bunch of carbs, right? Yes. So there are some rules.
And you feel more satiated.
Yeah.
It's harder to break down. I mean, you crave what you eat, right? If you start the day with carbs, the likelihood is you're going to crave carbs all day. I think for anyone listening, know that is going to happen. And sometimes I'll do that and I've seen it, and that's exactly what happens all day.
Oh yeah. I'll panic if I only have carbs for breakfast. Like if I'm in a hurry. It just happened the other day. I was like, I had a client in 5 minutes. I'm like, I have nothing. I've got no leftovers. I have nothing. And I was like, oh my gosh, I'm going to just have a piece of gluten-free toast with peanut butter on it. And I'm like, oh, that's not enough protein. Because I knew I would then be like riding my blood sugar roller coaster for the rest of the day.
And then it's so true.
But you look at the research, high carb, low fat diets have just as much weight loss as a ketogenic diet does. But that doesn't mean that that's easier to follow, because it's not.
No, and it doesn't mean it's necessarily better for your health. I remember having a conversation on the show with Laura Bryden, and she made a very good point. I love Laura, right? She said, if you don't feel like protein at breakfast, you're probably not hungry. So it's very easy to fancy carbs at breakfast. But if you're honest about it, if someone says to you, I could do you some eggs, I could do you some bacon, I could make you up a nice protein smoothie, I can give you some Greek yogurt, and you're like, nah, I just want a croissant, an almond croissant or a chocolate croissant. Likelihood is you are actually that hungry, right? Because you're just craving something easy.
Sugar. Yeah.
Craving sugar. Exactly. Yeah. I just thought it was such a good point when she said that. So it's like, just wait another hour and then you will be hungry enough to eat some protein at breakfast, and maybe have some apple cider vinegar or lemon and water to optimize your digestion and get those pancreatic enzymes flowing and bile salts and stuff. Yeah.
Yes, absolutely.
I think it's interesting. So any final tips? I think I'd love to get you back actually to talk about more natural therapies, just to kind of round this off.
Yes.
We don't have time today, because I think that would be really good for people to understand some of the more natural compounds they can use. But any lasting advice that you have to leave somebody who's really struggling at the moment, what would be your top tips? What should they do? They're struggling to sleep, they're struggling with hot flashes, they've got the menopause. What would you say? What should they do?
I think test first, because it's not the sort of thing you want to be guessing with. I do like the Dutch test, because you're going to be able to see how your body breaks down estrogen, which is really important, because some women will start using bioidentical hormones and they can gain weight from it because their body's not able to break down that estrogen very well, because their gut isn't healthy, they're not healthy, so it's just getting recirculated. Don't
That's a
count on
really
your,
good point.
yes.
Yes.
And the second point is, please don't count on your doctor. Try the doctor route first, but please know that doctors are not trained in bioidentical hormones. They will typically put women in menopause that are having a lot of reactions to it on birth control pills. I really heavily disagree with that. And remember, let's go back to the whole WHI study, the Women's Health Initiative. It was in the Women's Health Initiative. What was I going to say about that? I totally lost my train of thought.
You were talking about them being on the pill because it was interesting when the pill raises cortisol. When I was into like looking at what happens to your brain, if you read Dr. Sarah E. Hill's book, and I had her on the show, Your Brain on Birth Control, that is enough to make any woman think twice, I think, about birth control.
Yeah, well, the main ingredient in birth control is a lot of the time is progestins. And remember when I was saying about the WHA study, it was the progestin arm of the study that increased your risk of breast cancer and uterine cancer. And yet women, no problem. I'll hop on birth control pill for 15 years and not question it. But you tell them try bioidentical hormones, and they're like, "Oh my God, I'm going to die from it." Doctors aren't trained in bioidentical hormones. They have to go out and get extra training or specialize in it. Most of them don't. So work with somebody that understands it, even if you can then go to your doctor. Like when I work with clients, I tell them what I want them to do. They take that to their doctor. And in most cases, doctors are like, "Oh, okay."
They do.
So, okay, sure. So, and there's ways, and if not, then you have to find somebody that will. I mean, you guys in the UK have a great menopause clinic with Dr. Newson, the Newson Health Clinic. She's great. She does do a lot of, she's okay with birth control, which I disagree with. But besides that, she's great with she's very into the whole menopause thing, and it's very knowledgeable. But find somebody that understands it. Don't suffer. Know that you don't have to suffer. And I think that that's big. Don't listen to your doctor. If you're not 100%, if you've got anxiety, depression suddenly because you're getting older, you don't have a libido, you're having those hot flashes and night sweats and can't sleep, know that they can all go away. All those symptoms can go away if it was from perimenopause and from losing your hormones. So don't settle for anything but feeling your best. These can be the best times of our life, and women they fear it. They fear getting older. They don't want to look older. They don't want their body to start doing this. And then it starts to happen, and they're like, "What do I do?" And it's like, there's so much you can do.
So much you can do.
So much you can do. So don't settle for less than feeling amazing and enjoying the wise women years, because this is when you know yourself the most. This is when we start to actually go, "Oh, what do I want?" And compared to, what does my children want? What does my partner want? What do I want for my job?
It's the first time in your life that you can start to think about yourself. As you say, there are women now that are having kids in their early 40s. And so for them, actually going through menopause, they've still got young children. But for a lot of women, actually, they're teenagers, they're more independent. You're actually getting your life back and you can focus on you. And I agree with you. Don't listen. If your doctor pushes you back, if they push you back on anything, go and get another doctor, because I have that so many times with a range of different things, right? Where they say, "Oh no, my doctor said I was fine, but I don't feel fine." Well, of course you don't feel fine because you're not fine, right? You know best. It's a bit like when you had a baby, mum knew best, right? You are your best kind of health coach, if you like. So you need to understand how you feel and then find somebody who's going to listen to you and take it on board. I think that's so important because it's not fair. You can be made to feel quite stupid for many people.
Doctors all the time, they'll say, "Well, your labs are fine. You're exactly where you should be because you have no estrogen and progesterone because you're in menopause." And they're like, "Oh, that's perfect. You're good." But I don't feel good.
But I don't sleep. I'm losing my mind. I'm arguing with my partner. I never want to have sex anymore. I feel old. I've put on weight. I can't eat any sugar. What is wrong with me? You're fine.
And men don't go through any of this. And if they did, I mean, they can lose their testosterone, but they don't go through any of the stuff that we do with doctors. Doctors will hand out testosterone to a man like it's candy. "Oh, here you go. No problem." Women, it's a whole different story. And that's very sad and terrible, and it needs to change. Because if it was a man's balls that were drying up and their penis started to shrink and hurt, like they were having sex with glass, do we not think that they would maybe do something about this, and that every doctor would understand bioidentical hormone therapy? Yes. But because for women, think so. It doesn't happen.
Yeah, I agree.
It has to change.
So the message is find somebody who will listen. Karen's absolutely right. And get some help. And there's plenty of help. And so, Karen, where can people find more about you? You have an awesome podcast that I had the pleasure of being on last week. Yes. You have an amazing blog. Please link. Where can people come and find you and contact you?
KarenMartel.com, Karen Martel Hormones on all the social media platforms. And my podcast is The Other Side of Weight Loss. We've got about 200 episodes and a ton about hormones, of course, on that podcast as well.
Amazing. We will link to all of that in the show notes. Thank you so much for coming on the show. This has been such a fun chat. I really appreciate your time.
Thanks, Angela.